Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Welcome to Your Spine. I'm Dr. Robert Armitage, and this is all about your spine, your health. Last week on the show, we introduced you to the first vertebrae in the lumbar spine, L1. Today, we'll be discussing its neighbor below, L2, and of course, one below this vertebrae, L3. The lumbar spine is one of the most common areas where patients experience pain. Workplace incidents, poor posture, and sports injuries all have the potential to cause injury in this area of your spine. There are ways to minimize your risk, even when it comes to exercising safely. When spring arrives, many of us find ourselves getting off the treadmill and running outdoors on the trails and in city parks. Whether your goal is weight loss or training for the marathon, the impact of running with poor body postures and running mechanics can lead to many different running injuries. For a sport that simply entails putting one foot in front of the other, running potentially exposes the participant to a wide variety of injuries. Did you know that during the running of a mile, the feet strike the ground on an average between 800 and 1200 times with a force of 2 to 3 times body's weight? The repetitive nature of this type of stress is often the starting point for a number of overuse syndromes or recurring conditions that have been left uncorrected. The most common sports injuries fall under the category of overuse syndromes that can be classified as either repetitive strain injuries or cumulative injury disorders. With running, the most common sites of injury occur in the knee, lower limb or shin, foot, as well as occasional hip and low back pain syndrome. The good news is that most running injuries are not serious and are mostly preventable. Running injuries happen for a reason, and it is important to be able to identify the underlying cause of the injury. Factors that can affect the incidence or severity of injuries are most commonly a combination of the athlete's biomechanics, training schedule, and running environment. While evaluating the athlete, there are 3 factors that must be assessed. The first of these factors are called the extrinsic factors, those outside the runner's physical self. These can include running surfaces that are considered soft versus hard, or surfaces with decreasing rate of absorption, such as sand, grass, the treadmill, asphalt, or finally concrete. The second factor to look at with the running athlete is the intrinsic or within body variance. This can include body posture, pelvic balance, and the flexibility of the lower limbs. The third factor, and often the most common cause of running injuries, are training mistakes. This is to say, performing too much too fast by the new or returning runner. The athlete does not allow the body adequate time to recover and heal from the loads placed on their body. Each individual must listen to their own body, providing sufficient time to recover from the last exercise episode. This can often be a slow and tedious exercise in self-control. This is the athlete's greatest control over injury prevention. If the new runner or returning runner pays attention to these 3 factors, their success will dramatically improve. Remember, muscles and joints in good alignment function with the best efficiency, reducing the chance of injuries. For more information on the topics we've discussed today, be sure to contact your family chiropractor. Remember, your back is important to your health. Join us on the next show as we continue our journey down your spine.